I'm Lou Piro. I am your host for today. I want to thank you all for joining us and making this spectacular turnout and a great event. This is our 29th annual Elder Law Forum, and we're very happy to keep coming back. And the response, not just from all of you, but from the speakers that have dedicated and donated their time and talent to today's program, is amazing. So thank you all. If we can get some slides up. There are materials for the event, and you can find them at that address that's on the screen. So if you want to download materials, they are available to you. We have virtual attendees. Hello out there from virtual land. You can interact with us on your chat. So we will be monitoring the chat throughout the day. Be nice. Pose questions for speakers in the Q&A. Fill out the survey form, please, following the event. We build this event based on your feedback. So that survey form that you receive, that blue form, is extremely important to us, and we would very much appreciate you completing it throughout the day. For those of you who are social workers, we were able to give you 6 CPE credits, so be sure to attend throughout the day and fill out your forms at the end of the day to verify your attendance. And you can share today's forum on social. You'll see the address there, hashtag ELF2024, and let's get started. This is our law firm, Pierre O'Connor and Strauss, and we started this 29 years ago with 3 lawyers, and this is the roster now. We're up to 16. We're going through a whole series of presentations that cover the spectrum, no pun intended, Dan, but that cover the spectrum of legislation, executive, people who are in the field, people who are consumer advocates, trying to get every perspective on the issues of healthcare and long-term care for our seniors. Everyone should have a program. The outline of the day is in the program, so please follow that. These are our sponsors, and without them, we couldn't have all of you here and feed you breakfast and lunch and do this. So we want to thank every one of our sponsors. Please visit the tables. They are vendors out there, and they are here to interface with you. You can learn from them. We can learn. So please patronize our vendors. And as you go to the breaks, be sure to stop at the tables and have that conversation. So in 1995, we started the Elder Law Forum, and we had a seminar in a room that was 1/10 this size with about 20 people. And that was the first Elder Law Forum, just an idea to bring some people together and have a conversation. In 1996, I was fortunate to have been appointed to the governor's task force on long-term care reform. Senator Bruno appointed me, and I was 11 people that studied all the issues of long-term care in New York State. We issued a report. We were under the supervision of Commissioner Barbara DeBono at the time, and that report went nowhere. So here we are in 2024 with a task force, but now it's a master plan. And we have a master plan on aging that we're going to hear about today that Governor Hochul has put together. And we're very fortunate to have 4 legislators that are going to be up next. We have Lieutenant Governor Delgado, who's going to come and talk about his work with the governor's office, and representatives of the State Office for Aging and Department of Health, who are going to fill us in on where that master plan stands today. So we will all get an education on that. We had a program that we put together through the Bar Association, the Elder Law section, called the Compact for Long-Term Care, which was an alternative financing mechanism. Got passed in the Senate through the Assembly, but lo and behold, it appeared in Governor Patterson's program bill in 2011 or 12. And it became part of our culture to try to get better mechanisms for our clients. The elder law attorneys and the elder law bar represent people with disabilities, seniors, frail elders. So we're trying to get services for our clients and find a better way to do it. Along came managed long-term care in 2012, which was the state's answer on trying to organize Medicaid and trying to organize the delivery of services through the various providers in New York State through an intermediary, a fiscal intermediary that managed the financing and did the contracting. MLTC has been with us now for 12 years. There have been ups, there have been downs. We're going to hear from our legislators some legislation that's been proposed regarding managed long-term care. And then, as we all know, COVID happened. and everything went off the rails for about 2 years. Everything was prioritizing the response to COVID. Now we have the master plan bringing us back online. The one positive result for us is that we were able to go virtual throughout COVID, and now we're hybrid. So we are able to bring all of you together here in the room, and we have about 800 people online watching virtually. So with that, we have a rapidly aging state. I think we all know that. I won't give you all the statistics. You'll hear them over and over again. But we also have a worker shortage. So you have graphs that are going in opposite directions. The number of people who need care versus the number of people available to provide it. That is a theme that has been with us and will stay with us for the foreseeable future. So how do we rein in Medicaid spending? How do we arrange services? Senior facilities are under pressure. Hospitals are under pressure. How do we bring the healthcare system into the 21st century? Because healthcare is basically about 100 years old, the way that the mechanisms of healthcare and healthcare delivery have been structured. So how does it impact our providers in New York State? How does it impact our insurers? We're fortunate to have a couple of our insurance companies, MVP, CDPHP, here today to talk about their role in providing care and paying for it. And we all know these statistics. The number of people aging out in New York State is going up. The number of people leaving New York State who are younger is going up. So an aging population without a workforce or an inadequate workforce. So when will the sea change come and where will it come from? CMS has done a lot of things in terms of restructuring care, going to value-based payments. That is a big change. We're gonna look at things that are happening in New York with regard to consumer-directed personal assistance program, with regard to managed long-term care. How do Medicare and Medicaid fit together in something called dual eligible programs, which tend to be some of the most successful? And then finally, how do we get into the 21st century with technology? I haven't been to a conference in the last year that AI wasn't the lead topic. So should AI be the lead topic in healthcare? And should we be talking about how AI can revolutionize healthcare, not just in New York State, but around the country? So adoption of those new technologies is something we're gonna look at. But right now, we're gonna introduce our legislators. But to do that, I'm gonna bring up Dan Bazile. Dan is an Emmy Award-winning journalist, covered a wide range of stories from town board meetings to the State of the Union to terrorist attacks on September 11. Wrote and produced the PBS series, Help Wanted, Tools for Tough Times. He's fluent in English, French, and Creole. Good bit. A man of many talents. I give you Dan Bazile.
Lou, thank you. And it's a pleasure to do this one more time.
It's great to have you back.
Thank you. Hope I get invited again next year. Perhaps after I bloody the senators and the assembly folks with some questions. But good morning, everyone, and thank you for joining us from statewide audience. We have people all over the state virtually and here. We appreciate it. Today, I'm going to have a conversation with some lawmakers, and I want to introduce them to you because I don't want to make this too long. It's going to be a lot of questions, so the quicker we get to the questions, gentlemen and ladies, the faster we can get this done. And I don't think I'm going to get through all of them. So let me introduce you to all of them. First, we're going to bring up Senator Jacob Ashby. Senator Jacob Ashby is elected to the Senate in 2022. Occupational therapist, is a former Army reservist captain serving our country with the combat tours in Afghanistan and Iraq, and thank you for your service. In addition to his occupational therapist degree, he holds an MBA and Ed.D. in organizational leadership. He serves in the Assembly from 2018 to 2022, and currently is the ranking member of the Senate Aging Committee. Thank you so much for joining us today. And I also see Assemblyman John McDonald. John, thank you for joining us today. John has served in the Assembly since 2013. I remember when he was a mayor in Cohoes. Things never change. I get to interview you all the time about politics. He's a practicing pharmacist, chair of the Committee on Governmental Operations, member of the committees on alcoholism, drug abuse, health, higher education, and ways and means. John has worked diligently to support job growth and workforce development, as well as access to health care. John, thank you for being here. And we also want to introduce you to Assemblywoman Amy Paulin. I didn't see Amy. I believe she is not here yet, but she would hopefully come as we're talking about this. But Amy is an Assembly member, served in the Assembly districts since 2001 as a full-time legislator. Hopefully she will join us as we're talking here. And next, joining us via virtual, I believe we do have Senator Gustavo Rivera. Do we have him virtually? Yes, we do. All right, perfect. He's a proud Bronxite, right? And he has represented his Senate district since 2010. Currently the chair of the Senate Health Committee. He works to increase health care, coverage, access outcomes, and ensure a financially viable system. Championing innovation, he was the main sponsor of the New York Health Act in 2017, working toward a single-payer health system in New York State. All right, thank you so much for joining us. We appreciate it. All right, we're gonna start with the questions. Gentlemen, sit back and relax. Okay, first question is a general question, guys. This is a conversation again. Just remember, we can go back and forth here. First question. How will the final New York State budget impact New York State seniors rather? The same question for people with disabilities. How do you think that will impact?
Seniority, I guess. I was going to say the Senate's
I can
considered
certainly
the
take
upper
that.
house, but
I can
I've been
certainly
around
take
a little
that.
bit longer. Overall, from the budget perspective, I know there are a couple issues that are of concern to this group, but when you look at those with disabilities particularly, third year in a row, we've built upon improving salaries for those who work with the IDD population. I think that's important. Got a few hands there. Our biggest concern, and we're going to probably talk about the CDPAP program, I'm sure we're going to talk about the CDPAP program, is that we have a healthcare system that is really struggling. It's put a lot of time and effort and money into trying to save a lot of the hospitals and also our nursing homes. There's no promise that we're going to save them by any stretch of the imagination, but the whole system is under a huge amount of stress, particularly when it comes to staffing and many other issues. And we got to figure out what we're going to do with hospitals in the future. They're really in a very difficult spot.
I would agree with my colleague in that we're in a time of real struggle. And with this year's budget, I wasn't encouraged with what I saw in addressing costs and addressing the tax climate and addressing the workforce issues that we continue to see. And there is legislation out there that exists to address this, but we need to have the political will to get that across the finish line. Because I know that there are many advocates out there who are aware of this, many families who are aware of this, who come to talk with us nearly every day about it. We hear about these issues, and we need to be ready to address these solutions. And oftentimes you'll hear politicians and leaders say, the budget is about priorities. And this year's budget, I think there was a mixed bag in terms of the priorities that we see in this year's budget. So overall, I wish that we saw more addressing the issues that are facing the disabled population and our seniors.
And I'm not sure if y'all can hear me over there. Yeah, I'm not sure if y'all can hear me over there, but if you can, I think that when I think about this particular budget, for me, it was, and I talked about this on the floor of the Senate, for me, it's a harm reduction budget. And what I mean by that is that over the entire time that Cuomo was governor, every single budget, particularly as it relates to Medicaid, certainly as it relates to Medicaid, was always about austerity. And Governor Hochul started going a different direction, but unfortunately, this budget kind of went backwards. And some of the things that the governor insisted that we do in this budget don't make any freaking sense to me. The cuts to the Medicaid program, the changes to the CDPAP program, the cuts to the health home programs, some of the resistance to go out and get resources like coverage for all, which would give us federal dollars to extend the essential plan to undocumented people, therefore saving us potentially hundreds of millions of dollars from emergency Medicaid. You take all that together, and it's just a head scratcher. I don't know what the governor was thinking. Ultimately, what we did in the Senate, and certainly with help from our friends in the Assembly, is that we kind of got to a point what I call harm reduction. I was not happy with this budget, but it was the best that we could get.
I believe it was Assemblyman McDonald who mentioned there's a shortage of workers. So with that, I want to ask you this one question. Yes, there's a shortage of workers in home health care. Also, the reason why is because they're not getting paid enough. I mean, we're talking, someone can probably just walk in McDonald's and make more money than home health care worker. So the shortage is huge. We're talking sometimes 50%. Some people are short 50, 60% of their staff. It's just not doable. Or maybe we can use technology. We'll talk about that later. So with that, did the budget address any of this? And what are you guys doing about it? This is for all of you.
I guess we'll just keep going in this order. Is that easier? Go that way, yeah. You know, there's no one single solution in this whole situation. I mentioned earlier, for the IDD population, third year increase in a row, and really the focus is on those increases. They go to the organization, but they're particularly for direct care workers, the people who are actually doing the work. We dismiss of those administration. We know the whole thing needs to work together. You know, one of the challenges we have, though, is we have resistance in trying to add more individuals to the workforce. Let's take, for example, nursing. We know very well that some of the challenges in nursing homes, wings are still closed because they can't hire staff. Hospitals at Albany Med and St. Peter's aren't able to add staff to the upper floors, which is leading to the backlog in the emergency rooms, which is leading to your EMS providers waiting 2 to 3 hours on the ramps to discharge patients, which means somebody who might be having a cardiac event may be delayed getting a response. The whole ecosystem is challenged. The whole throughput has come to a stop in many aspects, and it's because of the staffing. Within the last couple of years, a variety of different programs have been established to encourage more people to come into the healthcare field, particularly in the nursing, scholarships, grants, support, but that's going to take time. You know, we shouldn't be surprised by this to a degree. COVID actually threw a lot of people, just said, I'm done. I don't need to go back to work on Monday. I'm done. We also, you know, I'm at the tail end. I know it doesn't look it, but I'm at the tail end of the baby boomers. My generation is realizing that, you know, Mondays are going to be a distant path. They're going to turn to Saturdays pretty soon. So we've had an exodus just because of time. We've had a traumatic event, and we've put in, now with tremendous success yet, we've put in safe staffing in the hospitals to try to help provide some relief to the people who are doing the work. But that's been kind of challenging. And you know, the nurses are pushing hard, the organized units particularly, to enforce those rules. And we can do that, although you're getting mixed messages from the administrations of the hospitals. We have to be tighter on that, because at the end of the day, we need to make it a safe environment for everybody. So there's a lot of moving parts to it, and it's not simple. The other thing, to be honest with you, which is a little bit a mix to me, and I meet with the unions regularly that represent whether it's PEF or whether it's the hospitals, but you know, I just heard over the weekend that, I can't remember what state I was in. I was driving somewhere, and they were the 46th state to join the nurses compact. There's an interstate compact that allows for licensing for physicians and nurses to move from state to state. New York State continues to refuse to participate. And you know, this is an ongoing discussion. The Education Department, which plays very heavy in this, has some concerns, but I think there's concerns with dialogue we can address. But the unions are actually not supportive. They've told me, you need to just hire more people. I said, well, we're trying to get more people because we don't have enough in New York, but we're just at a very difficult standstill, and we've got to kind of figure out, I think that's another one of many solutions that needs to be identified. We need to flood the zone with more healthcare workers.
I mean, Senator Ashby and Senator Rivera, before you answer this same question, I mean, we're talking about inflation is out of control, right? And I know the Fed just released information that said it's kind of cooling, but it's not. We know it's very expensive to live, right? It's getting even more expensive. It's just money. They need more money. We just need to give them more money. Now, where's this money coming from? That's the question. Same question again. What are you doing about it?
So my colleague and I, we actually sponsor a bill together that would provide a stipend for nursing preceptors to carry students. And this is something that, is a tradition in that profession and every allied health profession. And it's aimed towards keeping institutional knowledge on and keeping the workforce growing, because we did see a burnout during COVID of people who had maybe 10 years or more of experience start to leave the profession. So this would provide an incentive for them to stay on. But to your point regarding inflation and just the general expense in healthcare alone, I think John is supportive of this. I know Gustavo is, and I know Amy Paulin is as well, is we need to rebase Medicaid. And this has been an issue that I have been supportive on and been advocating for a long time. It's been nearly 20 years since our state has rebased Medicaid, and tie it to either inflation or every 3 to 5 years, make sure that we continue to do that so it doesn't go another 20 years. This would ensure a little more parity in terms of cost and what it would look like. It would be a costly endeavor to do this, but it would be a worthwhile investment. So we're not having to come up with different taxes. The MCO tax that we saw in this year's budget is another attempt to just stopgap the cost in terms of the growth of Medicaid. This would lift the floor on Medicaid, really for everybody, from the direct support professionals that we have to the clinicians to the administrators. I think we would see a robust growth in the quality of care and the services delivered. And what are we doing about it? We're passing a bill to get that done. I was disappointed to see that it was not in the budget. The chairman and I had a discussion on the floor of the Senate about this, but I think we are pushing to get this done before the end of session.
Senator Rivera, real quick.
You know that something, something really needs to be done when a fairly conservative Republican and a crazy liberal Democrat agree. It's like, we do agree, and I will add something else. There's actually, as far as pieces of legislation, talking earlier, there was a conversation about MLTCs. I think that managed long-term care plans are a failed experiment. And I know that there's folks in the room that are going to disagree with me, and I'm looking forward to having that conversation. But I think that if we're talking about money, because you were very specific, sir. You said, where's the money? Well, unfortunately, in the case of managed long-term care, it's going to insurance companies and not into the pockets of workers. So I want, so 7,800, S-7800, which is my bill, to get rid of MLTCs and actually transfer that back into a fee-for-service system, would put something like $4 billion back in the pockets of workers, who are the folks who actually, need to have that money, not insurance companies.
We're going to talk about MLTCs in a minute. Just one more question about this budget. Okay.
It was bad. Let's just say it was bad. It was bad.
Yeah, we'll talk about MLTCs in a sec, because I have a lot of questions about MLTCs. Tons of questions. Okay, this year, fiscal budget included additional funding for the hospitals, the nursing homes, and assisted living, but none for hospices and for home care. Why is that? Why did this happen? And is there anything you guys are doing to make sure it doesn't happen next year?
Because the governor didn't want it. I'll give it back to McDonald's.
You can see who the straight man is around here, can't you? So I guess I'm going to clean up on that one. The home care was really disappointing. Hospice is a whole nother dynamic. The hospice, as you know, is going through, it's a very valuable service, but Medicare is actually and that Medicare drives the bus on hospice. We play a role, but Medicare really drives the bus, and that's federal. It's on its anniversary. I can't remember how many years, but it's definitely, Medicare is kind of rethinking how it's supposed to work. And hospice is a lot different today than it was when I was first introduced to it. When somebody was in a hospice, like, oh, I'm sorry. And now you have people graduating from hospice and living in our community, which is great. But, the senator's right. At some point, decision was made how far we're going to go, and unfortunately, home care and this kind of plays into the whole MCO tax, which I don't know if I can't remember if that's on the list or not. We're going to talk about. That is a very interesting topic. It's not sustainable long-term if it comes to pass. It is New York State leveraging federal funds because, as you know, historically, except for the last 2 or 3 years, we as taxpayers in New York State send more dollars to Washington to go support other states. And this would be one of the few times we actually would win on this. We've won the last couple of years only because we had so many people impacted by COVID. But the MCO tax was intended to try to help all healthcare providers. And unfortunately, we really pulled back in the budget in regards to not counting on that being effective immediately in this budget, that maybe it'll be effective in the following years, but we took a conservative part in that because we just don't want to be basing our raises for workers based on something that may not come to fruition.
Yeah, I
You
agree.
could admit, Jake, just 1 second, you guys don't know us, there's screens, we're looking at each other, talking to each other. It's like, this is the craziest thing. I mean, at least Gustavo can turn the screen off and just laugh at us.
Yeah. It's probably a good thing that I don't see Gustavo when I'm talking because I know.
This is my lunchtime, so I'm good.
Yeah, I was really disappointed to see the evidence and priorities in this year's budget to include hospice and home care really not having a larger presence. And what are we doing about it? Well, we do carry a bill. Senator Hinchy, I believe, is the sponsor of a bill that would create an Office of Palliative Care and Hospice within the state that would ensure a line in the budget. And I am a co-sponsor on that bill, and I am advocating for it. I just recently met with hospice care out of St. Peter's and had a very lengthy discussion, and seeing the great work that they do and seeing the rise in the demand. And again, the common theme, a shortage in resources, whether that be human resources or cost. And it's coming to a head. And we need to do more to ensure that the services that are being delivered through St. Peter's, like so many other hospice care networks out there, are high quality. And we need to ensure that they are high quality and not just trying to proliferate them through other endeavors, but to make sure that those services stay with the high quality that they are currently delivering and grow appropriately.
Senator Rivera, this is a question for you specifically. Speaking of MLTCs, did you want to comment on the budget and hospices and home care?
Well, just as I said earlier, and I was being flippant, but I was being serious at the same time. A budget is a product of a negotiation, three-way negotiations. And in the case of Medicaid, certainly all the things that we're talking about, the failure to raise rates on Medicaid the way that we wanted to, the cuts to the CDPAP program, the cuts to the health program, the attempts at not having wage parity go into effect in home care workers, all of that was because the governor put it on the floor. She said, this is my proposal. And the Senate and the Assembly were like, Nah, what? No, no. And then we did the best that we could to get to a place where, where it was better. So that's why I described it as harm reduction initially. But then as far as my bill, oh yeah, bigger guns for the bill. Yes. 7,800. It is a bill to get rid of MLTCs. Again, I think they're a failed experiment. I think that wish I had the numbers in front of me, but it's somewhere in the neighborhood of $4 billion that we could actually, as opposed to going through middlemen, could go into the pockets of workers. That would go a long way towards keeping people there in that workforce, and most importantly, taking care of home care patients.
What's the status of the bill? I mean, is it going anywhere?
It was introduced earlier this year, so it's a new idea. It's a fairly new idea. It has gotten a level of momentum. The budget being 19 days late. I mean, the budget was due on April 1st, and we didn't get it done until the 20th, so everything got pushed back. Excuse me. Allergies have been messing with me. I wish I was in that room. I couldn't because I had to be here in the Capitol. But I wish I was in that room because I'm sure if I said in that room, does anybody have Zysel? Because I left my damn Zysel at home. So anyway, my allergies are messing with me. But the bill does have some momentum, but we are not, I don't think we're going to be able to pass it this year. But we have been having some serious conversations about how the bill is shaped, why it's necessary. And I'm hoping that we can move it next year. But for the moment, it was introduced this year and it's getting some good momentum.
Okay, so speaking of MLTCs, I hate to keep harping this, but I have more questions about it. This is for all of you guys. Okay, so the managed long-term care program, they have an incentive to actually, provide less care, right? The needed hours, if you're a for-profit, you're gonna want to do less and less in order for you to keep more of the money. I mean, that's just the way, efficiency you operate to make more money. So it has a disincentive to approve needed hours, right? So this leaves the applicants no choice but to pay out of pocket. I mean, I have examples of people just fighting to try and get reimbursed and try to get money. And I know the Assemblyman, you actually had a run-in with someone where you helped them to do this. I hate to put you on the stand here, but I have to ask you, so how can we fix this? I mean, you have people fighting to try to get care or to try to see, and they lose a lot of their own money. And there are only a few people, by the way, that can actually do this, meaning that they can hire attorneys to do what they need to do to fight this. So how can we fix this so that it doesn't go that far?
Well, first of all, it wasn't a run-in. It was actually called constituent services, all right? My resident, Stan, he's probably here somewhere.
Yes, Stan's here.
So, Stan's been a long-time state employee. He's very well knowledgeable about how government works and where it doesn't work. And he's like a dog on a bone. And he pursued things and he was getting jammed up a little bit. So, we have the ability to talk to these plants and say, hey, our constituent is supposed to be getting these services. He's paying for these services. It's supposed to be a covered benefit. And the good news is, and Lou will talk about later, he is the rare success story. And this gets into the challenge of, you're right, the MLTC plans are supposed to provide the services. Who's watching them? And that's a very good question. And I will go, it may not look it, but I've been practicing pharmacy for 35 years now. I've been around. I was around long before the MLTC plans were there. And the question was then, who is monitoring what's going on? And it's still a challenge, right, wrong, or indifferent. There was a decision made, and Gustavo's been here longer than I, but I think it was with the prior governor to implement these plans. And it was to merely leverage federal programs to make sure we can expand services. I will tell you, it's a program that doesn't fit into a conventional box. It doesn't lend itself to better oversight, but quite frankly, we need to find a way, because what bothers me, I won't be so dramatic as it keeps me awake at night, because my dog keeps me awake at night all the time. But when I'm out walking the dog at 2:30 in the morning, you do think about things, and quite honestly, Stan is the perfect advocate for himself. But I know a lot of the patients who fall into this program, they can't advocate at all. They, in some circumstances, have no idea what's going on. And at the same token, this is why we need to continue to find a way forward, because the fact is, most people prefer to stay home. As a former mayor, I hope people stay in their community as long as they can. And usually, it's a more cost-effective way of providing care and helps the system. But we've got to find a better way. And I have no idea on the audit process if maybe we have to ramp up more audits on these entities. Because in the past, when I've seen problems as a provider, and I know the patients, they have no clue what they're entitled to. My calls to DOH, and this goes back several years, were, well, we have a complaint-driven system. Well, if you don't know what the problem is, how do you complain?
Senator Ashby, do you have any thoughts on this?
So like my colleague, I worked in healthcare too, but only for 20 years, not 35. And did see a lot of flaws and hurdles that people have to jump through in order to get the quality of care that they need. MLTC is just one example of this. But I do agree with John in terms of being able to stay home and age in place being the better route. And in New York, it's very difficult, becoming more and more difficult for seniors to be able to do that because of the cost of living and because of property taxes. So this was another thing that I thought we were missing in this budget, and an opportunity in order to reduce property taxes. And there is legislation out there that exists. One would be to alleviate the county's responsibility for Medicaid. And New York is one of the few states in the country that still puts this burden on the counties. And if they did this, if they alleviated the county of this responsibility, even partially, it would set up for potentially the largest property tax reduction in our state's history, which I think would help bring people in, the workforce that we're looking for, and allow for people to work and stay home a little bit more. People would say, well, where are you going to cut? You know, what are you going to take out in order for this to be able to happen? Well, we were able to find billions of dollars for a number of different issues in this budget. So the money is there. We just need to make this a priority. I also carry a bill that would provide property tax relief, almost like the enhanced STAR for those 65 and older, up to a 50% tax rebate on their property taxes. So again, the legislation is there. We are advocating for it. It just needs to move.
I know, Senator Rivera, you probably have a lot to say about this, but try to keep it brief. Do you have any thoughts on this? I'm going to take some questions from the audience in a few minutes. I have one more question.
Questions from the audience. We're good. They got it. They covered it.
Well, one more question before I start talking to the audience here, because somebody is in my ear telling me that I need to start talking to the audience. But let's try to get one more in, okay? One more question about the CDPAP. Now, you all know what this is. The move to a single statewide fiscal intermediary model for the consumer-directed personal assistance program. You all know what this is, right? Okay. Now, here's the deal. There's a lot going on in it. Some controversial things happening in that. Some illegal things happening. I don't want to spell it out for you guys. But with that, what measures are being implemented, guys, to prevent service disruption, okay, to ensure that there's like service excellence in this model?
So I'll say quickly, just on this one, because this is again something that the governor wanted. She wanted to go to one fiscal intermediary. I've always been in agreement that the way that the program was originally organized allowed for some people, some bad actors, to take advantage of the program. So certainly I did not believe that we needed hundreds of fiscal intermediaries. We needed less than that. But the option of the one intermediary was something the governor insisted on. So what our job is, and we had to accept it eventually. I did not want to accept it, but ultimately that's where we landed. So what we did, we were able to get some assurances in there. And this is something that I certainly give a lot of credit to the Senate Majority Leader, because she insisted on this, that there would be some assurances in there related to independent living programs, as well as programs with that have geographies in mind. So we did get some things in there, but the implementation of it is going to be real tricky.
I was actually going to let Amy answer that question. What do you think, Amy? So anyways, the whole CDPAP program is, I'm very aware of where the audience is here, and I don't want to be the skunk at the party. Probably in 2017, 18, we started to get some things going on, conversations, and 2019, we made some changes, and at the time, Dick Godfrey was our health chair, and he was fighting them tooth and nail. And at the same token, it was very clear that the administration was going to keep pushing for greater change. Now, I'm very sensitive to this issue as well, and I'm going to answer your question in a second. But I think there are some numbers that need to be shared. In other states that have this program, and many other states don't have this program. New York State, and I love New York State, is very rich in providing programs. Our problem is we're not able to continue to sustain them in most circumstances. And one would argue if we implemented the program properly in the first place, maybe we wouldn't be here today. In other states, blue states, if you want to play the blue and red game, they use one fiscal intermediary. We had 650. We had 650 middlemen or middle persons involved in the process. Now, I'm not condemning them. At the end of the day, if the state allows a program to grow and people say, well, if they're going to allow us to do it, I might as well do it, and they got into the business. And to the senator's point, as the scaling back is going to one larger fiscal intermediary, but also to make sure that we don't forget who got us there. The independent living centers were the ones who really drove this program decades ago. They're the ones that have done, and they're still included in the program. And at the same token, there are unique populations, special populations, and sometimes it's language, sometimes it's other reasons that we want to accommodate. To answer your question, Dan, and this is something that was stated by many of us on the floor during the budget process, as much as we weren't happy to be doing this, we recognize that the most important thing is states' resources need to continue to be focused on providing care in the home. And if we have to change the intermediary, so be it. But at the same token, we have to watch the Department of Health, and I've already said this to the commissioner and the budget director. We are going to be watching this like a hawk, because it's not going to be a perfect transition. Anyone who thinks it's going to be a perfect transition, it's not. The question is, how do we minimize any negative impact to those working and those caring for the ones in their homes? And that's what we got to focus on.
No doubt it was a flawed portion of the budget, going from over 650 to 1. I didn't quite understand that logic, even if there are examples of just one fiscal intermediary out there. I doubt there were any examples of going from over 650 to 1. New York will probably be the lone example on that. And to that, it's just another demonstration of an extreme polarized measure. Instead of scaling it back a little bit more, I understand the fiscal constraint of it. I understand that there were probably bad actors historically for an extended period of time, but I believe that we could have been a little bit more measured in that response. In an area where we are trying to grow the workforce, I think this could potentially have a detrimental effect.
All right, some questions from the audience. We're kind of tight on time, so please keep your questions tight and your answers tight as well. All right, we're gonna start over here.
You're telling us politicians to shut up?
Yes, I am.
I can do 30 seconds or less an answer, McDonald. Let's go.
Game on.
First of all, thank you for being here to be in the hot seat, if you will. My name's Jean Chirico. I'm the president of the Hospice and Palliative Care Association. So I appreciate the comments that were made, supporting hospice. And I also appreciate all the work that the three of you and Assemblywoman Paulin have done in legislation to assure that the quality of hospice is maintained, that our certificate of need is supported. I'm a little concerned about the perception that because hospice is primarily funded through Medicare, that there's nothing we can do to support the hospices financially as a state. There's workforce dollars, there are a number of opportunities for dollars that we have not been included in, and I'm wondering what you think the state can do to financially support hospices who are closing.
Well, I think you hit the nail on the head. It's the perception. I mean, the reality is when you talk to the leadership, they say, hey, you know what, it's a federally funded program, but you're absolutely right. We need to continue to grow the workforce. I mentioned earlier about the nursing scholarship programs and other incentive programs to bring more people into state. We're not saying you need to come into state and work at Albany Med. We're saying we need more people on board. As you build and grow the workforce, there's more options to bring people into the workforce. Did we miss the mark on helping with support? Absolutely. No one's denying that. And you know, I reconciled it, not agreeing with it, but reconciled it. A lot had to do with the fact is we did not fully implement the MCO tax. We didn't. We're not accounting for $1 in this year's budget. We're waiting to see if this is actually going to happen. That is going to help for a short period of time, if it does come to fruition, to help address the issue for a short period of time. We still have some major issues to deal with our hospitals and health systems and figure out what they're going to be when they grow up, because we're in a very bad spot.
I said keep the questions and answers quick. All right, Senator Ashby, go ahead.
Oh, geez. So I think education is a huge part of this, and being able to open up access to hospice in places where maybe we typically haven't seen it, and for example, family type home for adults. And there's a number of them in my district, and we've been working together in trying to develop a way for them to deliver services there. And right now, the DOH has handed down a waiver process that they worked with Office of Children and Family Services on, and it is very onerous. And when you're looking at the people who are in these settings and the resources that they have to get through this waiver process is going to be very challenging. So I think that's just one example of many potential settings where hospice is struggling to enter. But the more that they can break through and provide those services, people will see the value in that. And I think if we can work hand in hand in passing Senator Hinchy's bill, which I co-sponsor, that too, legislatively and clinically, kind of going hand in hand, we can see a rise.
All right, Senator Rivera, you get to
Check this
answer.
out. Ditto. No, check this out. Ditto, and raise them across the board. Raise rates across the board in Medicaid, including hospice. And that was 5.56 seconds. Done.
Thank you. Thank you. We have a question over here, and then I'll get some questions from virtual audiences.
Hi, everyone. Brian O'Malley with Consumer Directed Personal Assistance Association. So I'm going to ask a question about CDPAP. I think there's a lot of misinformation and lack of facts that went along with this debate as it went on. The governor got on statewide TV and said, California has one fiscal intermediary, where if you just Google the phrase, like, how many fiscal intermediaries does California have, you get 58. And yes, Pennsylvania has one FI, but we have probably over 20% of our providers have more participants in their agency than Pennsylvania has in their program. So I think we have to work off a common set of facts. The ILCs won't have contracts to be FIs. They will have some sort of, one independent living center will have some sort of contract to provide some services. So, and the states that have transitioned have generally done so over 18 months. We're looking to do this over maybe 9 with no comptroller review on a $9 billion contract. Like, there might have been problems, and I can agree with everyone that, there is a difference between 1 and 650. And we don't need 650, but there's a wide range in there, and we were in a spot with 68. How are we going to ensure as a state that the 250,000 people who rely on this program get services and don't wind up in our hospitals, on the streets, in our nursing homes, or dead because they are going without the services they need to survive, critical healthcare services, and when other states that have 10,000 people saw 10% of their population wind up falling through the cracks in a one-to-one transfer?
Listen, this is the only thing I can tell you again is that this is not what we wanted. This is something I want everybody to remember. The governor insisted on this. It's not about laying blame. It's about being clear where this came from. The governor wanted this to go to the one intermediary. We will do our best in the legislature to do oversight. And as I said, there's some things that we got in there related to independent living centers, et cetera. But ultimately, this transition, we will keep our eyes on it as close as we can, because everything that you said is absolutely correct. And we need to make sure this transition happens and patients and that people that get taken care of don't fall through the cracks. But do not forget, ultimately, this is what the governor wanted.
Senator Rivera, Senator Ashby or Assemblyman McDonald? Okay. All right, we have another question here, so you get your chance to answer this one.
Hi, I'm Becky Prevey with the Association on Aging, and I represent the 59 offices for the aging throughout the state. I really appreciate all of the legislative support we've received. I have a couple statements and then a question, and I fully support Brian's comments about the consumer-directed program. It's a little-known fact that offices for the aging also use the consumer-directed program, so we anticipate definitely being hit with these cuts. But there's a couple things in the overall state budget that are very puzzling to the Aging Services Network. Obviously, we support non-Medicaid eligible older individuals to stay in homes and communities and to keep them off from Medicaid. And so in a lot of our conversations and negotiations, we talk about this ballooning Medicaid problem. We know the solution. It's the Aging Services Network. And to put that in perspective, we have about 20 million people in the state of New York. We're rapidly approaching the 5 million mark. For those over the age of 60, we have 4.1 million caregivers. So you're talking about half of the population in the state of New York. In addition to that, older people pay $72 billion per year in state and local taxes, which is 43% of the state tax base. The New York State Office for the Aging budget is less than 0.8% of the overall state budget, and we have almost 20,000 people that are waiting for services in the state of New York today. So when you look at that holistically, and you know that NYSOFA gets less than $200 million out of a $200 billion plus budget, and we have people waiting for services, our service infrastructure costs less than $10,000 per year on aggregate, and we serve people for 6.5 years. There's only 111,000 skilled nursing facility beds licensed in the state of New York with a 97,000 fill rate. So we know the game is in homes and communities, but we cannot get through budget negotiations anything more than tiny investments into the Aging Services Network. We walked away, and again, I thank the Senate and Assembly. Both the one House bills had significant investments to address the waiting list, and we walked out of the process with about $700,000 in additional revenue, which will serve about 70 people in the state of New York, which is really unconscionable when you know our average client is an 83-year-old low-income female who lives alone, who has 4 or more chronic conditions and needs assistance with bathing, dressing, toileting, et cetera. So if you want to solve the Medicaid problem globally, we need to invest in our infrastructure. It would save the state hundreds of millions of dollars. And my question to you is, how can we get this across the finish line with the executive, specifically when we're going through a master plan for aging process, and yet we receive no additional revenue to address those services?
The more you are in the Capitol, the better. The more that you can replicate that on the second floor, the better. Because it is something that, it is a message that we carry each and every day. And I would think that the governor being in office for the length of time that she has and seeing the outward migration in this state, leading the nation in it, zero tax relief, a struggling workforce across industries, in particular our most vulnerable, that we would have seen more of an investment, that we would have seen some tax relief, that we would have seen some sort of agreement that would allow working professionals to come to this state and make the investment to stay here. And we didn't see that. I haven't seen that in this budget. So I think continue to carry that message, continue to work with us in the way that you have been. You know, I know that you see that this is not a partisan issue, right? This is a priority issue. And you're absolutely right in that this population is the rising population and the most populous in our state, and it's taking the brunt. And we need to make sure that they're getting the services that they need and being taken care of.
I don't disagree. I don't disagree. I guess my battery. Who says Republicans and Democrats don't work well together? So I don't disagree with one word you said. And, you know, it gets into what you don't want to hear, right? It's about priorities. It's $239 billion budget. There's a lot of people that say we spend too much money, that we spend on a lot of things. You know, Jake mentioned earlier, and he's right, I've been pushing for years for the local governments to take off the additional $2.3 billion in Medicaid costs that counties are picking up. But what people don't talk about is for the last several years, we've absorbed $6 to $7 billion per year and taken off the backs of counties. And the counties are responding. I represent Albany, Rensselaer with Jake, and Saratoga counties. They're lowering their property taxes each year. And at the same token, besides paving every road known to mankind, you have over Rensselaer County, they're building new senior centers to help provide those opportunities. But we, the state of New York, absorbed that $7 billion. So we have a lot of competing issues. And it's unfair because at the end of the day, what you speak to is we can even double the investment and it's a blip in the overall budget, right? When you really look at the, right, it'd be a step in the right direction. And we have to continue to, as Jake said, have you in the Capitol every day. Get all the red shirts with AARP to get on board because I don't know if I really hear this from them. And they have probably one of the stronger presence as well because they also are a very membership-driven organization. We need to add more voices to the chorus.
One
I'll
more
just say,
question.
ditto. And just one thing, there's a question that was asked, how do we get the second floor to, I don't know. I've been trying to figure them out and I still can't. So I can't help you out on that one.
We have one more question from the audience here. If I don't get to your questions, I apologize. We're running out of time.
Dan, we do have a little bit more time.
We do have a little bit more time. Okay.
Well, some of us at 9:30, I gotta roll, just so you know.
Hi, my name is Darlene. My name is Darlene McGraw. I wanted to bring up the topic. People with disabilities go to work and do other things, and local Department of Social Services seem to be unaware. People like myself that receive CDPAP programs need to still be able to get programs that our FIs are doing a good job with, and we're not to be seen as sick. I have autism and other disabilities, and I really appreciate the services that our FIs and the CDPAP programs provide. So I was just wondering how our speakers feel about the way our local Department of Social Services feel about them not knowing the types of trusts and how the employment process, and so we can be more independent, because these forms aren't just for people that are elders and older, because people like me still receive these services too.
Well, thank you for the question, and thank you for everything that you do, and it's an incredible example. And you know, in the counties that I represent, they each do an incredible job of working with the residents who require assistance. As John mentioned earlier, Rensselaer County is building a number of new senior centers, so they're investing towards that population. I know that we also have a number of nonprofits throughout the Capital Region. I see Elizabeth Martin here from Living Resources, and they play a very integral role in helping the developmentally disabled population and those who require their services, really beyond, the families as well. Really a great outline. And from a state's perspective, we need to look at that and see the role that they play in the larger picture. We met earlier, I think John was there when we met with Center for Disability Services before the budget, talking about Article 29s and the role that they could play in helping to reduce traffic in our hospitals. Because so often, people will come to the ER for a variety of reasons, and when you have this population coming, they have complex medical needs. You know, they will come to the ER and they may have a J-tube, they may have a tracheotomy, they may have other issues that can present a more immediate need and stem the flow that you currently see. If these organizations could receive more funding and provide the clinical services that would help reduce the traffic, kind of steer the traffic back to them rather than towards our hospitals, it could play a huge factor. And I think, to your point, help you lead your life a little bit better, the caregivers lead their life a little bit better, and improve the quality of care all around.
Hey, Darlene, stand up for a second. So this is Darlene. Darlene has been a constituent on and off of mine for 20 some odd years. She is truly the role model for independence. She lives in Saratoga, she drives Car Bazile nuts at CDTA because she has single-handedly changed his bus routes multiple times. And she is a constant presence at the state capitol. She knows the BRT lines better than anybody else. And you can see her jump off on Washington Avenue, come into the Capitol, and then she usually spends most of her day in my office. But that being said, she's a constant good example of the fact that we need to continue to build opportunities and have advocates out there. And we also need to provide opportunities for work. You know, I'm there you go. And, you know, I'm trying to put the finishing touches on expanding the preferred source program, which allows private sector and nonprofit employers or nonprofit organizations who care for the disabled to bring more people on for the workforce to get them jobs. Because at the end of the day, when you look at the overall problem we have in healthcare, we have to live healthier. And living healthier means we get out every day, go out there and do something meaningful, have our job, support our family, and focus on that. Because quite frankly, most of our conversation is about addressing the people who are in crisis. And we just need to prevent more crises, which is it's kind of like car wax. You never know if it's being applied, but you know it's meaningful.
Okay, we have time for one more here. I think we have about 5 minutes left. 2
Well,
minutes?
y'all do,
3 minutes.
but I have a 9:30. But I have a 9:30, which is the reason why I'm still in the Capitol. So thank you for having me, but I do have to roll. Thank you for
Senator, thank you so much. Thank you.
Going back to the tax issue for seniors, what do you think about Jim Tedisco's bill to let us retirees or seniors get out of paying school taxes entirely? I know it hasn't gone over yet, but I thought that was an excellent idea. By the way, we are just two citizens. I'm a retired state worker. Thank you for inviting us here. We thought it was going to be all professional people, but I see there are some of us here, and we really appreciate your listening. And I want to tell you, I've already learned a lot, but I'd like to hear what you have to say about Jim Tedisco's bill to get us out of it. We don't have children. We decided never to have children. We're tired of paying for school taxes.
I know my colleague has been in office a long time, and there's a number of bills that he has out there that I am familiar with. I'm not familiar with this bill, and I would have to take a closer look at it in order to commit to it. I do appreciate you letting me know about it, but I would have some concerns just in terms of the number of those who could be eligible and what that would look like and how it could affect different districts. So I would be interested to see the financial impact that would have on the other side before I would commit to it.
I too am not that familiar with the bill, so I can't really speak to that. And you need to know what the impact's going to be on the overall, on not only the education system, but also your community. If you have a failed education system, eventually it's going to lead to a failed community because those individuals are part of it. So I think we need to be thoughtful about that. And, you know, once again, being the skunk at the party, the truth of the matter is there anybody here who likes to pay taxes? Please show your hands. The reality is we don't really, unfortunately in society, the problem, and this goes back to those guys who threw the tea into the port in Boston, you know, taxes are tough. Nobody likes paying them. And the part that they really don't like is they don't get to pick and choose which things they pay for, right? But the good news is we all have voices. We need to raise those voices because, heck, you're paying for it. You might as well try to get your money's worth and make sure it's what you want. So thank you.
All right, Assemblyman, thank you so much for your time. Assemblyman John McDonald, Senator Jacob Ashby, thank you so much. And we also want to thank Senator Rivera as well. We appreciate your time, guys. Thank you so much for being so nice and answering all the questions. And thank you for all of you. We appreciate your time as well.